In this video today, we are going to talk about treatment options for erectile dysfunction in addition to medications, which I've previously covered. If you're new here, I'm Dr. Rena Malik, urologist and pelvic surgeon, and I'm so happy to have you here. I cannot believe we are nearly at 1 million subscribers. So please, if you like what you see here, share this channel with your friends, make sure they subscribe, and help everyone get a little bit more knowledgeable about their urologic and sexual health. I want to give a special shout out to Blue Chew for sponsoring this video. Erectile dysfunction is defined as the inability to have penetrative intercourse and affects about half of men over the age of 52. But the questions that most of my patients ask is, why do people even get erectile dysfunction? Well, the number one cause is due to vascular problems, and that includes issues like high blood pressure, high cholesterol, lack of exercise, and smoking. Another 30% comes from diabetes. Over half of men with diabetes will develop erectile dysfunction. In fact, having the disorder itself increases your risk by 3.5 times. And the longer you have diabetes, the more likely you are to develop erectile dysfunction. That's because diabetes affects the blood flow and the nerves to the penis, both of which are extremely important for erections. Medications contribute to another 15%, and that includes most commonly medications for blood pressure, specifically those that are called thiazides or beta blockers like metoprolol, which is very commonly prescribed. Also, medications for depression, specifically SSRIs or serotonin selective reuptake inhibitors, commonly cause issues with erections. Other smaller causes of erectile dysfunction include neurologic causes, specifically things that affect the nerve function to the penis. That can include spinal cord injury, multiple sclerosis, or other neurologic conditions. Another 5% comes from pelvic surgeries like prostatectomy or other surgeries that happen in the lower part of the abdomen where the nerves course that go to the penis. And lastly, a very small percent, about 3%, are due to hormonal causes like low testosterone, low thyroid, or issues with your pituitary gland. So when you develop issues of erectile dysfunction, you should go see your primary care doctor and urologist. Particularly, you should be screened by your primary care doctor for cardiac disease risk factors, because erectile dysfunction can be the first sign of heart disease. And so if you want to learn more about that, check out my video that I made before about how erections can be the first sign of heart disease. When you see your doctor to talk about your issues with erections, they'll get a history from you. They'll ask a lot of questions about your experience with erections in the past, if this has been gradual or sudden, if you've had any trauma recently, as well as a physical examination to rule out any other physical causes that might be contributing. And often with that, we'll also get an early morning testosterone blood draw to make sure that you don't have any hormonal causes like low testosterone. Based on the history and physical examination, we can rule out things like psychogenic causes or factors that may be associated with your thoughts around performance anxiety that might be contributing to erectile dysfunction that are best treated by a sexual therapist or psychologist. Another test that some people might offer is a penile Doppler test, and this test looks at the blood flow to the penis. However, very often it doesn't change management. What it does do is it allows us to provide reassurance for patients who might have psychological causes of erectile dysfunction. And most commonly, it's used for young men who've had some sort of trauma and had a sudden onset of erectile dysfunction to identify areas that may have developed an abnormality called an arteriovenous fistula. And the reason there's not a whole lot of other diagnostic testing is because the treatment essentially is almost always the same. Unless you've had a trauma and you might benefit from a very selective surgery, which is extremely rare, then the treatment, as I mentioned, is always the same. So we start with lifestyle changes. So what can you do sitting at home to help improve your erections? So if you think about things that can help your erections, well, anything that's good for your heart is also going to be good for your erections. The most studied type of dietary changes are the Mediterranean diet, which is a diet high in fresh produce, fish, and polyunsaturated oils like olive oil. You want to avoid processed foods, anything that comes in a box really, saturated fats, dairy, and red meat. And in studies, they've shown that having a Mediterranean diet has improved erectile dysfunction or slowed the rate of decline in strength of erections. Exercise is also a great way to help improve erections. Multiple studies have proven this, and you want to ideally aim for 60 minutes 3 times a week. Now, you can break that up as much as you want. You can do 10 minutes in the morning, 10 minutes in the afternoon, afternoon, 10 minutes later, and you can do it over the course of the 7 days. So it doesn't have to be a big ordeal. It doesn't have to be all at once. Lastly, if you are on some of the medications that might cause erectile dysfunction, and we'll put up a list right here, you can talk to your doctor about trying to switch to either another hypertensive medication for high blood pressure or another medication for depression that might have less side effects for erections. And lastly, very simply, quit smoking if you are, because that's not going to help your erections. And if you're having alcohol on a chronic basis, meaning daily with large amounts, try to limit that or decrease that significantly, because that will also help with your erections. A lot of you ask if there's any supplements or herbal medications that can help. Well, there's some major issues here. Is one, we don't know exactly what is in the supplements. They're unregulated, and the ingredients and dosages listed on the bottle may not be what's actually in the supplement. And sometimes they're even contaminated with other medications that we already use for erectile dysfunction, like tadalafil or sildenafil or heavy metals. Interestingly, the placebo effect, which is when you take a pill that you think is going to improve your erections, is quite high in studies for erectile dysfunction. That's why we do randomized controlled trials, because when you take something and you think it's going to improve your erections, it actually does by up to 30%. And so when you see people saying they've had these great results with certain supplements, well, a lot of it can be from that placebo effect. Let's move on to medical treatment. So I talked a lot about medical treatment in my last video comparing tadalafil and sildenafil. So go check that one out. I talk all about how our body makes erections and how exactly these medications work to help improve erections. If you hate going to the doctor or you can't swallow pills, there's a super convenient option available to you called Blue Chew. It's an entire service. It's so easy. First step is you fill out a medical form online, and within 2 days it's reviewed by the Blue Chew team. You're connected to a licensed medical professional right on the platform. No extra software is needed. Then, if you meet criteria for treatment with medication, you'll receive a prescription of specially compounded sildenafil and tadalafil in chewable form. These are made by specialized licensed compounding pharmacies and delivered direct to your door in discreet packaging, just like this. It's delivered right to your door for as little as $20 a month. Blue Chew is available in all of the United States except for North Dakota and South Carolina. And to top it off, they have great 24/7 customer service. If you're interested in trying Blue Chew, make sure you check out the link in the description below, as well as the coupon code for a free 1-month trial of $20 off your first prescription of Blue Chew. Okay, outside of medications, there are actually other options that can help treat erections, and I'm going to talk about a few of them in this video. The first one is called an intraurethral suppository. This uses a medication called prostaglandin, which after you insert it inside the urethra, it diffuses across the urethra to get into the corporal tissue or the erectile tissue of the penis. This increases the amount of cyclic adenosine monophosphate. This is very similar to cGMP that I talked about in my last video about sildenafil and tadalafil. Essentially, it increases the smooth muscle relaxation within the penis to allow erections to last longer. It comes in multiple doses from 125 micrograms up to 1,000 micrograms. It's recommended to urinate before you administer it. And once you put it in the urethra, do it standing and then massage the penis to help absorb the agent into the tissues. The side effects for this include 32% of people complain of penile pain, 12% complain of some burning pain in the urethra, and about 5 to 6% complain of minor bleeding or pain, testicular pain, or their female partners may have some vaginal discomfort. And in a very small percentage, about 2% will get dizziness because this medication can cause a drop in your blood pressure. And lastly, make sure that if your partner is pregnant that you do not use this, because the prostaglandin in the medication can transfer to your partner and induce premature labor. Another option is a vacuum erection device, and I'm going to make a dedicated video about this later, but let me know if you've used one before in the comments below and how well it worked for you. And the last non-surgical option is an intracavernosal injection. These are probably the most effective option for erectile dysfunction. And this is usually a mix of 1 to 3 different pharmacologic agents that are injected directly into the penis. And yes, this sounds super scary, but the needle is really tiny. A lot of times when patients do the injection the first time, they'll actually look at me and say, "Oh, that's it? That's all it was?" So really, it's not as bad as it sounds. It's a lot of fear and anxiety because of course, it's injecting something into your penis, but it works very, very well. And how it works is it relaxes the smooth muscle of the penis and increases blood flow to the penis to help improve erections. As I mentioned, they come in 1 to 3 agents combined. The ones that are a single agent are typically prostaglandin E1. These are exactly the same mechanism of action as the medication that's in the intraurethral suppository we just talked about. Another agent that's used or medication that's used in the injection is called papaverine. And this works very similar to the medications sildenafil and tadalafil and other phosphodiesterase inhibitors because it has the exact same mechanism. It's a non-specific phosphodiesterase inhibitor. Phentolamine is the last agent, and how that works is it relaxes blood vessels to allow increased blood flow. The agents usually are called bimix when they have 2 agents or trimix when they have 3 agents. We typically recommend the first dose is done in the office so that you learn how to do it and you can see if you have a response. The efficacy of these is very, very high. As I mentioned, up to 80 to 85% of people will see a response with this. However, there are some side effects. 50% of men who use the single agent of prostaglandin E1, which is called Caverject or Edex most commonly as a brand name, will report some penile pain. However, that can be fixed by switching to a bimix or a trimix formulation. 3% of people may notice some nodules on the penis where they're doing the injection after using it for greater than 18 months. 2% will see some bruising and ecchymosis, and 3% can have what's called a hematoma or bleeding underneath the skin of the penis. And 1 to 2% will have headaches or dizziness. The most serious complication that we worry about is called a priapism, or an erection that lasts longer than 4 hours. I've talked about this previously, so check out some of my other videos where I talk about priapism or what to do when you get an erection that won't go away. Ultimately, if you've tried all these options or some of these options and you're still not having success, there are other surgical options available, namely penile prostheses. And I've made a couple of videos about these, so check those out for now. And if you want a more in-depth video about the different types of penile prostheses, comment below and I'll make one of those as well. As always, remember to take care of yourself because you're worth it.